Okay, everybody, we are going to go ahead and get started. We are really happy that you've joined us today for this webinar. My name is Emily Lakemaker, and I'm the Associate Director of Recruitment and Student Life here at the School of Public Health. And just a few logistics up here at the top before I turn it over to Leah. We are recording this, so if you want to go back and rewatch this or get some additional, focus on another area and get some additional information from that, you can go back and check this out on our YouTube channel. We get these up within 3 to 5 business days of the live event, and we will email out the link to everyone that's registered for this once it is live. So you can go back and review that as necessary. Additionally, you'll have the opportunity to type in questions. If you go to the top right-hand side of your screen, you can see a section for questions there. Feel free to type those in throughout the webinar. What we'll be doing is we'll go through our PowerPoint presentation first, and then that'll be about the first half hour of this program, and then we will go through and read your questions aloud and answer them. So in any that we can't get through in the hour we have allotted, we will be sure to provide our contact information so that way you can get your answers, your questions answered. So with that, I think I'm going to go ahead and turn it over to Leah, and we'll get started with the program. Yeah, you should be good.
All right, my name is Leah Tompkins. I am the Associate Director of Academic Affairs. I just gave myself a promotion. Associate Director of Academic Programs for the Executive Master of Public Health program here at the Rollins School of Public Health. And so the shortened version of my title is the ADAP. So each program here at Emory has an ADAP, 1 or 2, and so I am the main contact person for this program, and I interact with all of our students all the way from the recruitment admissions phase all the way through graduation and alumni relations. So I really am lucky enough to know our students all the way through their program. So I'm just going to go through our slides today about our executive MPH program, and then at the end, like Emily said, we'll be glad to answer any questions you might have. So the Executive MPH program does issue an MPH degree, so it is still a Master's of Public Health degree. And within our program, we do have the 3 tracks, or areas of study. So we have Applied Epidemiology, Applied Public Health Informatics, and Prevention Science. So while the degree issued as a Master's of Public Health, you do focus on one of these areas, and you will apply to one of these areas when you submit your application through SOPAS. We are looking to recruit working professionals for the program. So most of our students have an average of 8 years of experience by the time they apply to our program. The minimum required is 3 years of full-time work experience, and that's reviewed from your resume or CV that you upload with your SOPAS application. However, we do require that you have some full-time work experience in a minimum of 3 years. Our program can now be completed in 6 semesters. We're very excited that we have been able to update our curriculum and as well as update our tuition and fee schedule, and we will be going over that later in the presentation today as well. We'll go over each of the tracks in detail, and one thing about the EMPH program that's really appealing to a lot of different students is that we do have a hybrid program. So we do have the online program, but we also require face-to-face instruction. So our students come to campus at the beginning of the semester, complete the next 10 weeks online, and then return at the end of the semester. And we'll go through the schedule again in detail in here in a few minutes. So we have been doing online and distance education here at Emory for quite some time. This program started as a certificate in 1997, and then we became a full degree program in 1999. So we have been offering some version of this program for almost 20 years now. So definitely more than 15 years. So we're going on 2 decades of experience offering this program. So for our MPH degree, you do have to complete 42 hours of credit. Of those 42 hours, 36 hours is coursework in the classroom and online. We also have a practicum requirement, which is a minimum of 200 hours, and then also 4 hours of thesis or culminating experience, depending on which track you are in. So that totals the minimum hours needed to earn an MPH degree from an accredited school, such as Rollins. So of the coursework that you take, each student at Rollins takes 6 core courses. So you take a behavioral science course, biostatistics, environmental health, global health, EPI, and a U.S. Healthcare and Policy course. Those are required of any student here at Rollins, regardless of program or program format. You will then take the EMPH requirements as listed here. So we have a surveillance, then you get to choose between ethics or advocacy, as well as a public health informatics course. And then you will also take your track requirements. So this is where the programs deviate. So depending on which track you're admitted to, will determine which courses you take. As I mentioned, we do have a practicum, and it is worth 2 credit hours on your transcript, but it is a minimum of 200 hours working in your preferred setting. We have a practicum advisor. Her name is Susan Butler, and she is here to assist students through all aspects of their practicum, starting with idea generation, developing leads, determining your objectives, making sure that you get started in the portal where we collect your practicum information. And here is an example of how you might complete your practicum. So you might complete it over the span of 20 weeks and 10 hours a week. And this can be extended over 2 semesters in order to meet your scheduling needs. So as you can see here, there's less than 20 weeks in a semester. So these can actually be extended up to 2 semesters, which is approximately 36 to 40 weeks. So your schedule is worked out with your site supervisor, and then you determine how you're going to earn your hours up to a minimum of 200. We also require a thesis, which is required for any student, again, who is earning an MPH from an accredited school. So we do require that for the applied epidemiology that you complete what is known as a traditional thesis. And then we also have some other options for our informatics and our prevention science students, such as capstone projects or other types of culminating experiences. But you must complete one type of culminating experience in order to earn your degree. And again, that's worth 4 credit hours on your transcript, or 4 of the 42 hours for the program. Each student will select a thesis committee. Your chair must be an Emory faculty member, so it can be somebody who teaches in the EMPH program or somebody who just has an appointment here at Rollins who has a similar interest to you and is able and willing to work with you. You must also have a field advisor, so this is typically somebody off-site where you are working to gather your information or your data for your thesis, and then you can have additional members as needed. So here are some examples of what a thesis might include. So again, some of these are more of a capstone project or a culminating experience. They're not necessarily an original research study, which is what a typical thesis would be, which is required of our applied epidemiology students, but our prevention science and public health informatics students have a little bit more range as far as accreditation requirements in completing this experience. As I mentioned, we do have a hybrid program, so we do require our students to come to campus at the beginning of every semester for 3 days. It's a Friday, Saturday, and then half a day Sunday. And we have our dates scheduled out through 2017, and we'll be adding 2018 soon, so we're always working a few years ahead so that students can plan with their families, with their employers, to make sure that they are able to be here and be participating in classes when on-campus attendance is required. After our students come for our opening session at the beginning of the semester, they then return home and complete the rest of their work in Blackboard, which is our learning management system. So our courses are asynchronous, which means that you don't have a specific day and time that you log in throughout the week, although some of our faculty do offer optional synchronous activities. So like for our biostatistics course, both of our instructors for that class, they will log in at a certain day and time. So let's say maybe it's a Tuesday at 8 o'clock. You can log in and they will do a review session for the exam. Those sessions are recorded and those are also sent out to all the other students who weren't able to log in at that time. So even if we do have synchronous activities within the program, they are not required and they are recorded and sent out to everybody. But you both have consistent internet access throughout the semester so that you can check in on a regular basis and that you are able to communicate with your professors, with your classmates, with your group members on a regular and consistent basis. Our students then return at the end of the semester for their closing session, which again is a Friday, Saturday, and then Sunday morning. So while our students are here with us on campus, each course you are in will meet for 3 hours. So depending on if you enroll in our 2-course schedule or our 3-course schedule will dictate which days and times you meet. However, again, you will meet twice for each course for a total of 6 hours in each course. We do have more professional conference atmosphere than what you might think of as a traditional classroom. So our faculty really work to make sure that we have guest speakers available to you, that we have extra trainings, and that we use your time wisely while you are here on campus, so that you're not just here sitting in classes, being lectured at, but you also have a lot of interactive, engaging sessions and time with your peers and your faculty. In addition to that, we do have student support services. So in the program, you actually get 3 advisors. You get your academic advisor, which is me, your practicum advisor, which is Susan Butler, your thesis advisor, which is a person that you will select, and then we also have career advising, and we involve our career advisors on an as-needed basis depending on what the student's interests and needs are. So you will have a variety of student support services here in the school. Here is a quick look at our on-campus schedule. Again, depending on if you're in 2 or 3 courses, will dictate what times you're actually in class. If you are on the 3-course schedule, you will attend every class session. So on Friday, we have all of our meals here in the building in the Clayman room. We have a morning class, an afternoon, and an evening. Saturday, we have a morning and an afternoon class, and then Sunday, we just have a morning class, and then all of our students are typically departing either for home or for the airport around noon. As part of the program, we do require an online orientation as well as an in-person orientation. Our online orientation is called PRS 500D. This is a 0-credit program requirement, so it's not a degree requirement, but we do require it of all new students. This is a 2-week online interactive experience. It starts early August, and this year we actually just set our dates. It starts August 8th. And so all of this is, again, all online. Students are not required to come to campus for this. And you are guided through this by your instructional designer. So this is an opportunity for you to get experience using Blackboard without actually starting your coursework yet. It's also a way that you'll meet your cohort, people who will be with you through your program through the entire time, as well as meet the faculty and staff of the EMPH program. And here is our team. So we have our program chair, Moose Alperin, and she has been the chair for over 10 years now. Our associate chair for academic affairs, Dr. Gatos, recently came on board, and she has been very instrumental in the curriculum development, as well as our thesis advising seminars. You can see my glowing face right there. I'm your ADAP. Our administrative coordinator is Karen, and she helps set up all of our on-campus logistics. We've already mentioned Susan, who does the practicum advising. And then in addition to those staff members, we have 4 full-time instructional designers who are dedicated to the program, who support the faculty and students in the EMPH program. So Monish, Angie, Julia, and Naomi are full-time with the executive MPH program and support you and your faculty throughout the semesters. We also have associate track directors, and these directors are able to assist you more along the lines of thesis development before you go into your formal thesis advising. So for applied epidemiology, we have Dr. Guest. Mark Condi, who is also our school CIO, does applied public health informatics. And then Kathy Miner is one of our associate deans, and she is the track chair for prevention science. So these are all excellent resources and guides when you get to your thesis stage as well. So typically we are looking for working professionals in a variety of fields to apply to the executive MPH program. So the majority of our students do have some sort of health-related experience. It might be in public health, it might be in healthcare, health policy, it might be full-time paid work, it might be volunteer work, some sort of interaction with the health system here in the US and sometimes abroad as well. And then for informatics track, we tend to have a lot of people who are involved in computer science or information technology as well. We do review applications with a variety of backgrounds. And we also have students from a variety of geographic locations. So about the majority of our students do reside in the state of Georgia, and some of them do live within the Atlanta metro. But we have more and more students who are joining us from outside of the immediate area. So here you can see our admissions data for the locations of our cohorts over the past 4 years. So you can see we're sort of branching out more and more. So we had a student from Chile in fall 2012, and then recently one from China as well. They are both finishing their thesis and are graduating this year. So it is possible to either live internationally or have a lot of international travel, as our student in China. She was based out of China, but she traveled all around the world, was able to complete the program because they were able to plan ahead using our on-campus dates so that they knew when they needed to be in Atlanta. Here are the bachelor's degrees that our students have had in the past 4 years as well. So you can see, even though we are looking for a health-related experience, we really span the spectrum when it comes to backgrounds and interests. So if you don't have a degree in health or health promotion or health education or anything with the word health in it, don't let that sway you. We do review applications from all sorts of different students with all different sorts of backgrounds. So depending on your background, hopefully you see something here that might be related to yours. If not, you're always welcome to contact me and we can talk about how your prior experience might be beneficial to you on your application for the EMPH program. For our most recent cohort in fall 2015, we did admit 56 students. The majority of them were prevention science, which is pretty typical. Applied public health informatics was our second largest track cohort, followed by applied epidemiology. Our gender cohort, again, heavily skewed towards females, which again is pretty typical for public health. And then here is our cohort by ethnicity, and we are a minority serving program for the most part. So we're very glad to have a diverse body of student learners who have a wide array of experiences and to share with us. Next, we're going to go through the different tracks. So first is applied epidemiology. So this is a very narrow and specific track. Typically, people who apply to epidemiology are going to become an epidemiologist or something with the word epidemiology in it. So it's very narrow and focused. And if you are interested in running an investigation, analyzing an outbreak, this might be the perfect track for you. So there is a pretty heavy quantitative sequence. You take 3 semesters of epidemiology, and then you follow it up with a modeling course, 3 semesters of biostatistics, and then you also take some specific population courses. So we have now turned this into a selective for maternal child health, or you will take chronic disease epi. Here are some of our applied epidemiology faculty. Some of our faculty members in the program are full-time Emory employees who are on faculty here, and some are adjuncts who are working out in the public health field and teach us part-time. And you will see their research interests below their picture. And here are just a few examples of what our students have gone on to do after they become alumni and graduate. So we have students getting positions in major and important government and state agencies, which is where the majority of epidemiologists are hired. It's going to be at the state or federal level. The applied public health informatics track is also pretty narrowly focused. This is going to focus more on the connection between technology and data from a health practice or a health setting. So people who work in electronic health records or who work in any sort of IT space within a healthcare or health setting, who want to be able to migrate and manage the information coming out of these different organizations will be interested in the applied public health informatics track. Here are the courses for our informatics students. So as you can see, these are more IT based. So data management, project management, informatics solutions, and so on. Here are 2 of our faculty. Paula works full-time for the CDC as an informatician. And then Jamie actually lives in Boston, where he works for the State Department of Health, and both of their interest areas are below their pictures as well. And here are some job titles of our recent graduates. They tend to be more of a consultant type, or they are hired by a health insurance company or a health some sort of health administration, like a hospital or some sort of large entity like that. And our prevention science track is our broadest track, and if you are unsure of which area you would like to go in with your Master's of Public Health, it's more than likely that you're a prevention science student. So if applied epidemiology didn't sound appealing to you, applied public health informatics didn't sound like something that you would be interested to pursue, you are more than likely a prevention science track student. And this is why our prevention science cohorts tend to be larger, is because this track can be tailored to each student's individual interests. So if you want to use it to go into the field of health education, or if you'd rather go into more of a health policy field, this is the track that you'll be able to do that in. Here are some examples of the courses you'll take within this program. So you'll take research design, needs assessment. If you want to work in a community or a community health setting or a nonprofit, prevention science will be your selected track. Here are two of our faculty. Dan works at the CDC full-time and teaches for us part-time. Iris just recently retired from teaching full-time. However, she has still agreed to teach with us on a part-time basis, and we're very lucky to still have her. And here are the titles of some of our recent graduates. So they tend to work, again, in nonprofits or in government agencies, NGOs, or out in the community. All right, so next we'll talk about the admissions process. So we do require that you complete and submit your application through SOFIS. And you will have to submit, along with that application, copies of your official transcripts from any schools from where you earned credit, a copy of your GRE scores if you are applying to the applied epidemiology track. We do not require GRE scores for prevention science or public health informatics. You can submit your scores for these tracks and they will be included in your application review, but they are not required. You must submit your current resume or vita, and it must show a minimum of 3 years of full-time work experience. A personal statement demonstrating your commitment to public health, your professional goals, and then also how the degree will benefit you and what you plan to do with it after you graduate. And then 3 recommendation letters from your evaluators. So in SOFIS, your references or your recommenders are called evaluators. So when you see that language in SOFIS, that's what they mean. So we were always looking for a mix of references. So we are typically want to have a letter from your current supervisor, a letter of support showing that they are aware that you're pursuing a graduate education and that they agree that it's an important part of your education and your work experience, and that they are willing to allow you to take off time to attend on campus. Maybe a letter from a previous supervisor, maybe a colleague. And then academic references are always good as well, but if you've been out of school for a while, that's not always possible. But we're always looking for a mix of references. If you're an international applicant, in addition to the SOFIS requirements, you will have to submit your TOEFL score. If you have credit from a non-US institution, you must have all that credit evaluated by the World Education System, or WES, and have that sent to SOFIS to be included with your application. Then you must also be able to have a financial certificate that shows funding for at least 1 year of study. Again, the GRE requirement is only for the applied epidemiology track. We are typically looking for scores in the area of the 60th percentile in each testing area. So that's verbal, quantitative, and then the analytical writing section. We can also accept the MCAT or the ECFMG certificate if you have that. Your scores must be completed within the last 5 years. Or if you have a terminal degree from a U.S. institution, we can waive that requirement for the applied epidemiology program. So if you are applying to the applied epidemiology program and you have the MCAT, the ECFMG, or a terminal degree, please contact me and I will make sure that your waiver is applied. So in order to apply, we recommend that you go and start your application as soon as possible if you haven't already. Our priority deadline date is March 15th, 2016, so that's a little bit less than a month. All applications that are completed by this date will be reviewed for admission as well as scholarships. So if you're in the process of completing your application and requesting your letters and your transcripts, please do so in the next few days so that we can have that processed and get it to us sooner soon after March 15th, if not before. And here's the application timeline. So depending on how much time you have to work on your application, it might take you anywhere from 2 to 4 weeks to complete your application in Sophos and have your transcripts and request your letters through the portal. Sophos will have your file from anywhere from 2 to 6 weeks while they receive your documents and add them to your application. After Sophos has everything they need to complete your application, it's verified and sent here to the school, to our admissions office, where it can be for processing from anywhere from 1 to 4 weeks. And then after that, it is sent here to the department. So there is quite a bit of time lapse between when you submit your application and when it's reviewed for admission. So earlier is always better when you're applying for admission to graduate school. And again, here's another way of looking at the application process. So you submit your application through Sophos. It comes here to the school. Within the school, it's distributed to the department review committee. Our department review committee reviews applications on a weekly basis. So depending on when your application is received throughout the week, the next time the committee meets, your application will be reviewed. So we review on a rolling basis. So every week we're looking at applications. We don't wait until March 15th and then review all applications. So it is an ongoing process. And then once a decision is made, you are notified electronically to the email that you applied with about your application status. If you are waitlisted in your first choice of department and you have a second or third choice, your application will automatically be sent to your second choice for review. And then if you are waitlisted or not granted admission to that program, it will be sent to your third choice. Let's back up for a minute. I did want to make a note about on the bottom of this slide. So if you are planning to apply to more than one program here at Rollins, please be sure to apply to your first choice program in Sophos and pay one application fee. After your application is submitted, you can then contact the school and have your second or third choice added. If you add all of them in Sophos, they're going to charge you an application fee for each program that you add. And that's not necessary. So please apply to your first program only, submit your application, and then contact the school to add your second and or third choice. So next we'll talk about tuition and fees. So one important thing to know about the program is that our students must be enrolled in at least 5 credits to qualify for federal financial aid, and you must also be a U.S. citizen. So if you enroll in the 2-course track, that's only 4 credits a semester, you will be ineligible for federal financial aid. We do offer a payment plan that's now available year-round, so we used to not be able to offer it in the summer, but now we are able to. So the cost is your tuition and fees is broken up into 3 installments. One payment is made early in the semester before classes start. One is made midway through the semester, and then another is made at the end of the semester, and that can happen every semester if you choose to sign up for that. Or you can enroll part-time, again, in our 2-course option. You won't qualify for federal financial aid, but if you're paying out of pocket, this tends to be the more affordable option. So as I mentioned in my email yesterday, to those of you that recently signed up, we have been approved to change our tuition and our timeline for the upcoming academic year. So students who are admitted as of this fall, the fall that you've hopefully applied for, and if not, are working on your application. If you are taking the 3-course schedule, which is at least 6 hours a semester, your tuition will be $10,600 a semester. So that's a flat rate for each semester that you are in the program. We do go year-round in the EMPH program, so we do go fall, spring, summer. And our program has now been condensed into 6 semesters. So before it was a 7-semester at a minimum, and now it's a 6-semester program. So we are updating our course sequences, which are also called our degree plans. You may have seen these already on our website, and we are working to get these updated and sent to our website designer within the week. And I'm also going to send each of you an email as well with a copy of these once they are available this week. So this is really exciting news as far as tuition and timeline for our incoming class. However, if you do choose to do the 2-course schedule, the flat fee will not apply. So if you enroll in the 4 or 5-hour program, tuition will be assessed at the current rate of $1,700 a credit hour. So students who entered the program before this year pay their tuition by the credit hour. You have the option to go to a flat fee if you enroll in the 3-course schedule. The tuition will remain the same at $1,700 a credit hour for those who choose to go with the 2-course schedule. And this program will take 3 years, including summers, to complete. So it'll be fall, spring, summer for 3 academic years, starting in the fall. And again, I'll have these course sequences out to you as soon as possible. So all of our applications that are received by March 15th, are completed by March 15th, are automatically reviewed for both admission and scholarships. So here are the scholarships that are exclusive to the EMPH students. So the main campus student population is not eligible for these scholarships. These are exclusively for our students in our program, and some of them have very specific requirements. So that's why when we review your application, we will let you know if you are eligible for any of these scholarships, and if there are additional steps that we need for you to take in order to grant you the scholarship, we will send you an email and let you know. For example, the Hearst Scholarship does require a letter of support from your employer. So if you do work at a state or local health department in Georgia and you would like to be considered for the Hearst Scholarship, we would request that you submit that letter. Our other scholarship opportunities include the Merit Scholarship. This is our most common scholarship that we award and can be awarded to any applicant. And it can be awarded in any amount up to $18,000, and that can be awarded for 1 year or for up to 2 years. So every applicant is automatically reviewed for Merit Scholarship. And if you are an Emory employee, you are likely eligible for Courtesy Scholarship. Depending on your length of employment, please make sure that you contact your HR representative to get additional details to make sure that you are eligible. And also be aware that courtesy scholarships are considered income and will be included when deducting taxes. So here are just a few reasons about why our students choose to enroll into the EMPH program. We're consistently ranked in the top 10 of programs for schools of public health in the US. And typically our EMPH program is ranked either first or second. So last year I think we were ranked second. This year we hope to be ranked first, and it typically goes back and forth like that. So really we're in the top 2 as far as executive programs. We are in the public health capital of the world. The CDC is right next door. The American Cancer Society is here. The Carter Center is here. We have so many agencies and so much opportunity for our students to make connections, to get involved, and to get the experience that they need in order to move forward in their career. We are accredited not only by our regional accrediting agency, which is SACS, but also by CEF, which is the Council of Education for Public Health. So we actually have 2 accreditations that we are maintaining throughout the program. We have a full team of dedicated instructional designers who support our students in the program. We have a wide array of faculty who are doing great work in their fields and often win teaching awards here in the school. And it really is the best of both worlds. So you can still remain in your full-time job, but receive a degree from a well-known and respected school of public health. And then we really work to make sure the curriculum is immediately applicable so that what you learn in the class you can take back to work with you and use it in your everyday jobs. So here is our contact information. You've likely all received emails from me at some point in time, so you're welcome to email me directly, or our general department email is just emph@emory.edu, and that is my phone number on the screen, so you can reach me at that number. And then our link to our homepage is here as well. So we are now going to answer your questions, and Emily's going to pull those up. All right, let's see. I'm sure there are some.
Okay, only one so far, but feel free to, we're going to read these aloud and answer them, but feel free to type in your questions as you have them. We've got 25 minutes left on the webinar, so we've got plenty of time to get through these. So first up, Stephen is asking, for the scholarships, do federal public health employees qualify for any of these?
So your application will be reviewed for Merit Scholarship if you are a federal public health employee. 2 of our scholarships are specific to Georgia residents, so unless you have a Georgia address, you won't be considered for those. But the third one, I believe, is the Saratine, is for a public health employee. I don't know if it's necessarily relegated to federal or not. I would have to look into the details of that one, but you will be reviewed for all of our scholarships that we offer.
All right, Victoria is asking, can EMPH students participate in GIFE, the Global Field Experience, to meet the practicum requirements? Yeah.
Yes, as long as you have the ability to travel and meet the requirements for the GIFE, and we can make sure that it meets our requirements here in the program. I don't know that there's any, I've not worked here long enough to have the experience of advising a student who's been in GIFE and done a global field experience, but I would be glad to do that.
Yeah, and I'm kind of in the same boat as Leah. Generally, students that are in the EMPH program, since they're working full time, they generally can't take 3 months to travel to Uganda or something. But if you're in that situation, Victoria, then that's absolutely something that you could do.
Yeah, and we have talked about before doing a shorter experiences abroad for our EMPH students and going more of as a cohort for those who want to opt in, and doing like a shorter practicum experience abroad, maybe anywhere between 80 and 100 hours. And then having the students complete a second practicum here in the U.S. So we have talked about doing field experiences abroad that would be organized through the MPH program exclusively for our students. That would be scheduled well in advance and would be pertinent to their interests and their ability to travel. And so that's something that we're looking into as well. And I offered to volunteer my time to go.
Kind.
I know. I said that I would go with them as the trip leader. Wow. So. Yeah, we're givers.
I'll go as the co-leader.
Okay.
So no one's putting any questions right now, but feel free to put some in because we certainly got the time to address them. But one thing that I do want to mention is that for those of you that are in the Atlanta area or nearby that are in the Executive MPH program, you guys have, and really this would be anybody, but generally it's the Atlanta students that can take advantage of it. You guys are considered Rollins students. There's no it's not a different level of student or anything like that. So any event that's going on campus, any seminar or any resources available on campus, the libraries, the technology, all of that, that's all still available to you guys. Again, generally it's only the Atlanta or Georgia-based students that can take advantage of that. But that's, a big thing to take in consideration as well.
Yeah, so some of our students who maybe don't necessarily live in Atlanta, but travel to Atlanta quite a bit, I make sure they know that while they're in the metro area, they as long as they have their student ID with them, they can access the building after hours. They can access the library, so they have access to all the same resources and support that somebody who maybe lives across the street might have. So whenever students are in the area, I encourage them to access campus and to make full use of the resources. And quite a bit of things are offered online and recorded, such as this webinar. So we're doing more and more virtually in order to support our EMPH students.
Yeah. All right, Pamela is asking, I'm a student in special standing this semester at Rollins. So will I need to have my transcript resent? Yeah, absolutely. Because Pamela, that was sent directly to us here at Rollins, whereas when you apply for this program, you have to apply through SOFIS, which is the centralized application service for a majority of the schools of public health in the nation. And so your application through SOFIS will not be deemed complete until it has all your transcripts.
Yeah. And I think they have a Massachusetts address, right?
SOFIS?
Yeah.
Probably a DC.
Yeah, they're somewhere up in the more of the Northeast. So you'll actually send your applications the opposite direction from Atlanta, which really doesn't make a lot of sense. But SOFIS aggregates all that for us and makes it into one file and then transmits it all electronically.
So nothing will come directly to us. All right, Rajan is asking, is the practicum done locally at Emory or arranged at our home location?
For the most part, our students who do not live in the Atlanta metro arrange it in their home community or in a nearby metro area. So for our students who might live in a more isolated geographic area, they tend to complete their practicum with a local health department, a local agency, or they might drive to a nearby city and complete it there. But it's up to each student to identify which setting they would like to get their experience in. That's going to work for them as far as location and time. So for the most part, it happens in your home community.
All right, Lucia is asking, the priority deadline is March 15th. Is there a final deadline for fall of 2016?
So after March 15th, we will continue to review for application or for admission. But likely we will run out of scholarship funds in early April. So that's why we say completed by March 15th. Everything that comes in with a submission date before March 15th is still considered for scholarships as well as admission. We don't have a final deadline because we continue to review for admission until we have a full cohort, and we're not exactly always sure when that happens, especially since we have 3 different tracks. So last year, our applied public health informatics track filled pretty quickly, and we had to go to a wait list pretty early, I would say early May. And then our prevention science track filled, and then our applied epidemiology track filled, but it might, be completely the opposite this year. So we never know how many applications to expect for each track. So I always say earlier is better when you're applying for anything really, but graduate school, definitely.
Mm-hmm. Victoria says, are applications of the prevention science track students who do not submit GREs viewed differently or scored lower than those that did? Do you recommend we submit even if it's not required?
We do not view the GREs any differently for those who do submit them. So if you have a GRE and you didn't score in the 60th percentile, I would just not submit it.
Yeah.
So I wouldn't submit it unless you have really strong scores.
All right, Hannah is asking, I deferred my enrollment last year and am accepted in the EMPH program this year. Do I have to repay the enrollment fee if I paid last year?
I think the deposit that you paid last year was also deferred. So
my
understanding is no.
If you paid your deposit last year to secure your deferred spot, you don't need to pay it again.
Right.
If you didn't pay a deposit last year and you just filled out the form, truth be told, I don't know if the deposit was required to secure your spot as a deferred student. But if you already paid your deposit, you won't have to repay it. But if you haven't paid a deposit, you will. Yes. Michelle is asking, are there opportunities to do a practicum at the CDC?
So quite a few of our students actually do their practicum at the CDC. The CDC, of course, has so many different areas and departments, settings. It's really such a wide array of options for our students that it's more likely that they'll find a practicum there than if nowhere else. And at least probably 4 or 5 of our teaching faculty work at the CDC. So if the student is able to find an opportunity that matches their timeline and interests, they are definitely able to do their practicum at the CDC, as long as it's not your typical full-time job. So that is one thing about the practicum. It cannot be your full-time regular job for which you receive compensation. It can be in your same employers, but it must be like in a different department or a different office, and you must have a different full-time supervisor.
All right, and Jasmine is asking, I am unsure if I will apply to the EMPH or traditional on-campus track. Can I apply for both? For example, can I apply for this fall and pay $124 and then contact the school to apply for the MPH in global health? Yes, when you go through SOFIS, you can indicate, when you go through SOFIS, you'll want to apply to your number one choice, more or less. So try to figure out which one that is, Jasmine, and then you'll pay just whatever that fee is that SOFIS charges to go through and do your application. And then once we've received your application here at Rollins, which keep in mind that can take up to about 4 weeks or so once you've submitted through SOFIS. But once we've received your application here, you will be emailed instructions on how to submit for your second and third choices. You won't have to contact the school directly. It's an automatic system that we have in place for that.
I wasn't aware of that. So the Global Health, though, is a main campus program, and their priority deadline was January 5th.
Yes, and so keep in mind, too, with that is that we, much like the way that EMPH does theirs and basically just building a full cohort, that's similar to how the traditional program works, but that they tend to fill up more quickly than the EMPH. We don't have a hard and fast deadline, like a cutoff date. This early in the process, we're certainly still accepting applications for the fall, but the longer you wait, the earlier you submit, the better. Let's just put it that way, because there's no way for us to know when we'll reach our max. All right, Hannah says, have students found it difficult or easy to balance between school work and full-time jobs, to balance their school work and full-time jobs?
I think it really varies by student, and so some of them are on the 3-course track and working full-time and traveling for their jobs and have families. So all of our students have so many responsibilities. I think it really ranges, where some of our other students are working full-time and taking the 2-course option, and so they're obviously going to have less coursework than a 3-course, and maybe they're working 3/4 time, or maybe, and some of our students actually get to use their time at their job because this is considered professional development, so they get to use a certain percentage of their work hours each week to work on their classwork, which is really nice. So I think it just really depends. For our Visit Emory session in April 1st. Yeah, April 1st.
Visit Emory, yeah, April 1st.
April 1st is our Visit Emory session, and we will have a student and faculty panel that day, and we encourage admitted students who are able to attend that, and again, it will be virtual as well, to ask those questions directly to the students, because you'll get a variety of answers back.
Okay, Steven's asking, for the EMPH, are there only 3 concentrations to choose from? Is there no global health concentrations?
There is no global health track at this time. We have a global health. We are only required to have 1 global health course in our curriculum as part of our accreditation requirements. However, with the prevention science track, like I mentioned, it's very much tailored to the student's interest. So within that track of prevention science, you would select global health as your topic of focus. So we do not have a full global health track, but you can incorporate global health into the prevention science program.
Okay, that seems to be it on the questions. So if you do have any additional ones, you've got Leah's contact information here, and so feel free to reach out as needed. But I think with that, we'll go ahead and log off. You got anything else you want to add, Leah?
No, please submit your application soon.
Yeah, the sooner the better. Okay, thank you guys so much for joining us. Like I said, we were recording this, so we'll have this up on our YouTube channel within about 3 to 5 business days. Thanks so much, and I hope everyone has a great week.